We've heard about New York being the epicenter of the pandemic in the United States. You are on the front lines. What are you seeing? How has the last week been for you?
The last week has been unprecedented. It's been incredibly stressful. It's been so many calls coming in, over 7,000 a few days in a row. There's been so many stories of heroic deeds done by the members of EMS in New York City and other first responders. But this is an EMS event for the most part. You know, you're going to call, you feel sick, you call an ambulance. It's been tremendous in so many ways, and it's been exhausting. I have a lot of members who are exhausted. They've been working multiple shifts every day. They're not going home to sleep. I have a lot of them that have slept in their cars because they don't want to infect their families. So it's been an exhausting week, but we're doing it.
We've heard about the volume, the sheer number of calls that emergency services is getting from New Yorkers. What happens if that volume of calls, what happens if the number of calls just continues to increase?
So yes, it's unprecedented what we've been getting. If it continues to increase, we're going to have to get some help. The normal call volume for EMS on a regular day would be about 3,500 to 4,000. We are now about 40% above that. You know, we're hitting 6,000, 7,000 every night. It means people are going to wait for an ambulance a little. If you're a lower priority, you know, if you are home and you maybe mildly sprained your ankle and you need an ambulance, you'll get one, but it's going to be a while. So what we're asking the public to do is to kind of hold off if you genuinely don't need an ambulance, because the call volume is through the roof. There's only about 4,500 of us.
Do you feel adequately prepared to tackle the crisis that you are seeing?
Our training makes us equipped, but the department in the city has not equipped EMS properly. We need what's called the N95 mask. That's what will help us not so much infect not only ourselves, but infect the public. We're coming into your houses, and if we have to reuse these masks or use an inferior product, there's the potential that I infect others. So we need those expeditiously.
What do you say as a first responder to New Yorkers who feel concerned?
These are trying times, and it's appropriate to feel concerned, but when you call 911, we will be there.
We asked the fire department of New York for comments on Almojera's statements about lack of PPE. They responded in part, quote, "The department is following guidance from CDC and state and city health departments and looking to best manage low supply affecting all healthcare workers, which includes first responders nationwide. These guidelines are N95 are to be used only for aerosol generating procedures. They are not to be used in any other situation. Surgical face masks instead of N95s are to be used for fever, cough, call type patients. No masks are required for other call types, such as trauma calls." They went on to say, "The guidelines above are to conserve our supply and ensure it is only used when medically appropriate. We are not reusing masks at this time. At the moment, we have a good supply of these items for several weeks."
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.